I am certain that all of you are extremely excited to hear today's keynote speaker, Joe Jones. Joe is the founder and CEO of the Center for Urban Families in Baltimore, Maryland, and he is literally the national leader when it comes to providing programming and services to support fathers and their families. His work has influenced the national efforts to serve fathers, and he is a true inspiration to those of us in this field. I had the privilege of hearing Joe speak about his center and all the work he does nearly 20 years ago when I was still a student studying fathers and families. And he truly inspired me to continue in this line of work. I really appreciate all he has done, and I'm so glad he's going to join us today. Please join me in welcoming Joe Jones.
Wow, Cynthia, thank you so much for those really kind words. You probably stretched the truth a little bit there, but that's okay, and thank you so much for what you contributed to the field. I mean, your work, your research, what you've done to contribute to the literature is to be highly commended. And to Mo, thank you for framing this conversation and your passionate words to kick things off. And, before I go any further, let me say a belated Happy Mother's Day to all the moms and mom figures. And of course, a very healthy and hearty upcoming Father's Day to all the fathers and father figures. It's great that we are together and to be talking about families and fathers and what it means to strengthen our communities and have them healthy and whole for children. I'll talk a little bit about the work, a little bit about the underpinnings of the work around fatherhood. Well, and I want to start with a little bit about my own personal journey into this work. And I won't be able to go deep. We have a lot of time, but I have left a few items behind. There's a podcast, if anyone is interested. It's probably one of the things I feel most proud about the time I had to spend with Dr. Antonio Artelli at what's called Leadership of a Network World up at Harvard at the Kennedy School. And he and I did a podcast that encapsulates a lot of my personal journey, the work, and the organizational development related to the center. So that's there. And there's also a report on young fathers, really looking at the needs and interests of young fathers, in particular 18 to 24, that's available for those. And then congratulations, this isn't not to be understated that we are able to come together with nearly or over 2,000 registrants, doubling from last year. And I'm honored to be with you all for the 2021 Texas Fatherhood Summit. So let me start by, on the personal side, by sharing I'm born and raised in Baltimore. I am the son. I was born to two parents. I was the only child of these two parents who were married. And unfortunately, their relationship disintegrated when I was about 9 years old. And they didn't have the tools and capacity to help their young boy, their young African-American son, to understand what was happening with the family. So that disintegration impacted me greatly. And a few years later, I succumbed to some bad personal choices, a little bit of peer pressure. You mix in some just being a knucklehead. And I ended up engaging in drug dealing and eventually using heroin, injecting heroin. And for 17 years, I was both a drug dealer and a drug addict. And it's hard to be both of those things at the same time, in and out of incarceration, and had a son out of wedlock. And very fortunately, at the end of those 17 years, I was fortunate, after many attempts at getting clean and sober and outpatient drug treatment, I landed a slot in a 1-year residential drug treatment program that I actually went into to avoid going to jail. My primary interest wasn't to stop using drugs, it was to avoid going to jail. And luckily, I was there long enough to be able to get a foundation in sobriety. And when I went to court, the judge did sentence me to 5 years in the Department of Correction, which I was fully prepared for. But then he paused and said, look, I'm gonna give you this last shot. And if you successfully complete this drug program, I'll give you an opportunity to move forward in your life. And I took that deal and haven't looked back. And with the God of my understanding and a great support system, I was able to move forward. And one of the things I wasn't sure about is what I wanted to do with the rest of my life, right? The first half, I'd given it to the street. The second half, I wanted to give to reclaiming my son, thinking about building a family, and wanted to give back to society in ways in which I was always prepared to do, but couldn't because of my addiction. And I ended up working with as an assistant living counselor, live in with a group of men, adult men who were largely developmentally delayed, who didn't have family or support system. And that is where I got the itch to get into human services. And I realized I didn't want to work with that population, but I did get the itch. And one thing led to another. I took that job and it parlayed it into a job at the Baltimore City Health Department, working in maternal and child health. And in maternal and child health, we were charged with reducing infant mortality and to engage pregnant women in Baltimore City. There was no interest, there was no awareness of fathers. And so as I'm working with these women to get them into prenatal care, I came across the dads, and those dads said, I need help too. The problem is I was charged with making sure that we reduce infant mortality by getting women into prenatal care. So it was a bit of a struggle to get the health department to recognize the value of these dads in the context of these women having healthy births. But undeterred, sort of like Mo's passion, I pushed forward, and eventually the health department said, look, either we're going to have to fire this guy or we're going to have to give him some ability to engage these dads. So they allowed me to work with a subset of those dads. And fortunately, that led to us aligning work that was happening on the national stage at the same time, particularly with the interest that the federal government had through the work of then Vice President Al Gore. So the work began to take shape. I then expanded the fatherhood program, also began to introduce workforce development into the intervention. And at the health department, we had this really robust body of work around reducing infant mortality with an intentional engagement of fathers and engaging folks in the labor market. But after 8 to 10 years, I got a little frustrated being in bureaucracy. So I moved forward with creating the Center for Urban Families, where today our mission is to strengthen urban communities by helping fathers and families achieve stability and economic success. And the reason why I start there is because the work that we did originally only focused on, and I'm trying, oh, there we go. It only focused on getting people into entry-level jobs. And then we realized that we needed to go deeper because the folks who we were working with had high barriers to labor force attachment. Dads who wanted to engage with their children, wanted to engage in employment, but they had barriers, over incarceration, child support debt that was insurmountable, no way that can, in the course of their lifetime, could it be paid off, limited and or not so positive experience with the educational system. And so we decided to build a body of work to strengthen families by getting them to be socially and economically mobile with a set of supports. And I'll come back to this on the back end of this presentation and closing with a story, about what it means to be all in with families, particularly the families who we target, who live in distressed communities, don't have great support systems, don't have access to services that can help propel them on the ready. And so we decided that as an organization, our mantra would be to dismantle poverty and to be unapologetic about it. But I want to shift a little bit to where this work kind of began in the federal government. And as you'll see on your screen, in June of 1995, President Clinton issued a memorandum. And I want to read a part of this to you. I am firm in my belief that the future of our republic depends on strong families and that committed fathers are central to those families. You can see the rest of it for yourself, and I'll go to this next paragraph. Therefore, today I'm asking the federal agencies to assist me in this effort. I repeat, all executive departments and agencies to review every program, policy, and initiative herein after referred to collected as programs that pertain to families to ensure we are appropriate and consistent with program objectives that they seek to engage and meaningfully include fathers. And you can read the rest of it, but it is all directing the federal apparatus to look at opportunities to engage fathers. And each federal agency had to develop a report that was submitted back to the president through office. And myself, along with others, were engaged by the vice president to review those plans and to make recommendations and suggest changes to what they submitted. And that began to direct the federal government to do things like that are happening today, for example, at the U.S. Department of Health and Human Services, where since the Bush administration, there have been a set of fatherhood demonstration projects, starting at $50 million a year under the Bush administration, increasing to $75 million under the Obama administration. And those grants and that program continues today through the last administration and now into the Biden administration. So that's an example of how an executive action by the leader of the free world helped to put in place a foundation that leads to a lot of the work that many of us are doing, including the work that Cynthia has been engaged in to provide contributions to the literature through research. Now, this is one, if any of you know Ross Chetty. So Ross Chetty is one of the country's leading demographers, right? And he has a body of work that really is tied to how people in zip codes live. And because of some examples of just poor circumstances in some zip codes, his data suggests that if you're born there, you will live there, your children will be born there, and neither the parent nor the child will be successfully economically. But what he says here is neighborhoods that have good outcomes for Black men typically have three characteristics. They tend to have relatively low poverty rates. They have a high presence of Black father presence, and they are areas with low rates of racial discrimination. It's not about whether your own parents are married or not. It's the rate of presence of fathers in your community, more generally, that's predictive of outcomes. And these are the examples of the federal government researchers contributing to a body of work that suggests that if we want families, communities, and children to be healthy and whole, we have to be very, very intentional about how we look to engage dads.